Okay, so let's start right there with CBS News medical contributor Dr. David Agus, who's been on the front lines of this fight. Doctor, always good to see you. Tom said there has been so much talk this week about double masking. We saw a bunch of it at the inauguration, or more. They said, is it worth putting on more than one mask?
This virus is more infectious, which means fewer particles can spread the virus. So you need a multiple ply mask. The hospital masks have multiple plies in them. The cloth masks don't. So wearing two masks gives you multiple ply. We have to do whatever we can to stop the spread of the virus. And we are still not living by that mask mandate, unfortunately. And we're seeing record numbers across the country. Some states have leveled off. But with this new, really infectious variant, I am really worried that it's going to continue to go up.
And Doctor, real quickly, I know there's also been a lot of talk over the months about face shields or goggles. Do you recommend those at this point?
No, I mean, a face shield basically tells everyone around you, hey, I'm taking this virus seriously. But wearing a face shield in addition to a mask doesn't add that much protection unless there's flying liquid. So we wear them in an emergency room because there's a potential for liquid to be sprayed. But in most places, it doesn't add a lot of value.
Some 20 states now are saying that they have variant strains that have affected people in their state. So what do we know about these, and just how much harder are they hitting us?
Well, we're not doing a great job, first of all, looking for the variant. I bet you it's in most states at the present time, and it's more common than we think. And so if it took 10 minutes of me talking to you to give enough particles for you to catch COVID-19, now that number is 4 or 5 minutes, so it is easier to spread. And so we have to be up on our guard here. And, what we think now is that the outcome, people get just as sick with this variant, but it's easier to spread. What we think is that the vaccines work against some of the variants, but some of the variants, particularly the Brazil and the South African, there's some question if the vaccines are as effective as they are against the regular strain of COVID-19.
Vaccines can only be effective if they're given. Right now, the CDC shows that some 39 million doses have been distributed. Only 20 million have been administered. How do we jive these numbers?
Yeah, I mean, to me, it's a crime. The notion that a vaccine sits in a freezer instead of somebody's arm today just makes no sense. Well, right now, every state is in charge of their own distribution plan, and many are not doing a great job. And so we have to get better at it as a country. And so many of these things, I think the Biden administration is talking about federalizing. That is taking the role of what the states are doing and bringing that to the federal government and making it more uniform across the country. So the same criteria of who gets vaccinated in every state, and developing pre-registration software so people can register and then distribute the vaccine in a much more efficient fashion. We have to do better.
We have heard some people concerned with the supply and where will it be. AstraZeneca, Johnson & Johnson, both working on theirs right now. Do we have any sense of a timeline when those may be available and what that does for overall vaccinations as we go forward?
Well, prior to the new administration, it looked like the Johnson & Johnson vaccine will be available mid-February and AstraZeneca beginning of March. My hope is that those are accelerated. There are tens of millions of those vaccines sitting in freezer between now and then. The data aren't going to get better. The vaccines aren't going to get better. Just the regulators are going to be more comfortable. They're approved in other countries, one of them. And so clearly we need to get them out. The more we get it out now, the less the variants are going to be a problem, the more the virus doesn't have a chance to change. And most importantly, we're going to save lives.
Dr. David Agus, thank you as always.